Hello, everyone. This is Dr. Hockman. I'm the medical matchmaker, and I have the amazing Dr. Fortner here. I'm so excited to introduce her to you all. Before we do that, I will just remind you I help doctors find jobs where you can really enjoy practicing medicine again. I'll help you through the interview process, the negotiations, all of that. And let me tell you about Dr. Fortner today. Now, this is her very first video interview. So let's show Dr. Fortner some love in the comments. If you're watching this live or if you're watching a replay, please type hashtag malpractice sucks. So, Dr. Fortner, can you tell us a little bit about what you do?
Yeah. So I help physicians get peace of mind and confidence and joy back despite adverse events or unexpected bad outcomes that happen in medicine or medical malpractice. So it's exciting stuff.
That's really cool. And I remember when I was applying for medical school, one of the questions on the application was, what could be the worst thing that happens to you as a physician? And my answer, of course, was, oh, well, if a patient dies, obviously. And, a family member at the time who was a physician said, absolutely not. It's getting sued. And I don't think I could wrap my head around that, except now that as a physician, I've seen it, family members, friends, and it is devastating. So, I am so grateful for what you do helping doctors through this, because I think there's a huge feeling um, of isolation and feeling like you did something wrong. And, having worked with so many physicians looking for jobs, that's a question I need to ask all of them. And, it's extremely common. I mean, I didn't realize how common it was. So I'm so grateful for what you do.
Yeah, it is a common. Actually, the stats show that if you're in a low risk specialty, which is like primary care, if you practice till you're 65, you have a 75% chance of getting one claim. And high risk specialties, surgical specialties, OBGYN like myself, 99% chance. So it is so common, but I think no one's normalizing the conversation. That's what I'm trying to do. I think it's very important for us to understand that it is a normal thing. Although, even though it is normal, at the end of the day, it never takes away the emotional pain that we go through. And I think it's because we really mix up who we are with what we do. And we've sacrificed so much to do medicine. I mean, at the cost of missing family stuff. And when it happens, it's devastating. It rocks us. When I was going through my own lawsuit, I know the worry, the anxiety about my future, what it was going to do for my reputation, my income, my career. Was I going to be able to work in other places and, have the life I wanted to live because of all this? Or was something going to happen, right? I mean, that is so prominent in the beginning of going through a lawsuit. But then I think that the shame starts to set in, even when you do nothing wrong, even when you follow standard of care and you do all the right things. When there is an unexpected or bad outcome, it happens to all of us, even when we do everything correct.
Yeah, no kidding. And even, I had one physician who the lawyer had him settle. I'm curious to hear your thoughts on this. This was a patient who had fallen in his office. It wasn't that he did anything wrong and she broke her arm or something. And she, of course, sued, which should have gone on to a different type of insurance or malpractice and whatever, bad outcome insurance, but not physician malpractice. And his lawyer had him he had him settle. What are your thoughts there? Now this is on his record forever. What are your thoughts on that one?
Yeah, the thing about it is it's money. And it's all money. It's a business transaction. And when people see that they can get some money because of something that had happened, that's when things start to go awry. And when they put the money in the formula of how much it'll cost to go to trial to fight this versus just settling, it's cheaper to settle, and many times. And so that's probably what happened in this situation. But it is unfortunate because the National Practitioner Data Bank does store all of the payouts that go out with malpractice. Now, I will say, when it comes to like hospital credentialing and like bodies that get to look at the National Practitioner Data Bank, they do. a lot of lawsuits do not alarm them, right? They don't alarm them to the extent that we think they do. Now, multiple lawsuits with one physician may, but in all big picture, I think they realize that just because there's a payout doesn't mean someone did something wrong.
Yeah, that's good to know. And just as a reminder for anyone watching, if you have questions, please let us know. I have so many questions, so so I'm happy for you all to interrupt me. And remember, hashtag malpractice sucks if you're watching this. Um, so I have a question. No one wants to get sued. Is there a way that we could, to some degree, prevent a
Mhm.
malpractice lawsuit?
Yeah. So, I mean, at the end of the day, right, we can't control other people, but there are things that we do know of reasons why patients sue. And the top three things that patients say that they go seek an attorney for is number one, they feel that we left out details, that we were dishonest or not as transparent as we should have been, that there were details left out in the case. And so their perception is they're not getting the whole truth. And when they feel that way, they seek counsel. The other reason is if they don't feel appreciated for what happened to them, like a complication from surgery or something that, they had this, unexpected outcome, right? That we never thought. And then they come back to see us. If they don't feel appreciated for what they went through, and really what they're saying to this is they want to feel heard. And so I really talk about this because I think it's so important. I think many of us as physicians, we're rushed. We have to see patients every 15 minutes. EMR bogs us down. I mean, there's so many things. And really, patients don't need extra time. They need compassion and sort of empathy, and that they're heard. So it doesn't take a ton of time to do this, but it's like looking at them, not looking at your computer, giving them a handshake when you walk in the room, telling them, gosh, I'm so glad you're here. I so understand what you've just been through. It's like just small amount of words that can have so much meaning to them that can change their entire perception of what has happened. The other thing I like to talk about is apology and apology laws. There are certain apology laws state by state. You're going to want to check your state for what your state allows. But there's two different types, a full apology or a partial apology law. So in states that have full apology laws, you could actually say that I'm so sorry this happened. And you could say, I'm sorry that, I did this. Like you can admit that you had done, whatever that medical error was. In those states, they cannot use that against you in a court of law. And in partial apology laws, you cannot admit guilt, but you can say, I'm so sorry this happened to you, and they can't use it against you. And so I would check with your states if they have an apology law and what type it is. But also, I just want you to know that what's happening now, because I just told you why patients sue us mostly, they think we've left something out. They think that did not appreciate what they went through. Apologies actually help with that, if you think about it, right? And so this is very important. If I walked in after, a complication came from surgery, and I just looked at the patient, I said, I'm so, so thankful that you're here. I know you've been through so much. I'm so sorry you had this complication. That would go so far. And
That's huge.
yeah. And the thing is, we don't do it because we've been trained, our culture has been trained not to do it for years and years.
Yeah, and there's definitely, I mean, I think at the back of all of our heads is the fear of being sued. And so if we apologize, it's almost a feeling like I did something that's worth you suing me for, and I think there's that big fear there as well.
Yeah. Yeah. So I think it's something that we have to get better and better at. There's actually hospitals right now doing disclosure programs like apologies in a setting where the providers are there along with the patient, and they're having like a mediation. And sometimes there is payouts happening at this event, but there's also apologies going on. And what they're finding is instead of the malpractice rates going up and these people going out and suing us, it's not happening. Now, they're few and far between, and we still need a lot of studies for this. But I do think that it's an important thing for physicians to know what they can and can't do. So go check your state laws and see if it's something that you can do, because I think it'll go a long way, especially with those patients that have had an unexpected outcome that or a complication.
Do we see more litigation around patients not getting what they want? You know, there's of course the patient reviews and Price Ganey scores, but you know, also with litigation, there's a lot of fear around maybe not giving the patient the medications they come in asking for, or getting enough images or medications or whatever it is. You know, there's what do we call it? Lawsuit medicine. Do we see more lawsuits around, or defensive medicine? That's what we call it.
Yeah, defensive medicine, right? Yeah. I think the thing is, I don't know if that in particular we've seen an increase, but I will say that I do think the times have turned. I've talked to several defense attorneys recently from pre-COVID to post-COVID, and I do think there is they're seeing some increase in med mal cases. And some of it's because of the delay COVID gave us where nothing happened. So of course there's going to be a rash of increase of malpractice cases, but there is some talk in the field about not only an increase, but also more plaintiffs oriented, so that trial might not be something that's best for physicians. So we're just not sure yet. In the past, the statistics were prior to COVID that if a physician went to trial, 80% of the time they would win and have a defense verdict.
That's great.
Yeah. Mm-hmm. Yeah.
If a physician were to use lots of templates or scribes, do you know if that changes anything? You know,
I think it helps with physicians in terms of like showing compassion and empathy and being able to really talk to people without the computer screen. I think this is super important this day and age. It is all perception. And one of the things that I like to also teach for physicians that are worried about something that had happened with a patient is really sitting in the patient's shoes and their perspective before you go into the room, and really understanding where they might be coming from. But almost going in the room with no computer, if you can, is super helpful. And that's why a scribe can really help, because it just, that personal touch can go so far. And right now with, you know, just the way medicine has gone in general with the overbooking and all of that, I think just makes it so impersonal, and patients don't like that.
and nor do doctors. We don't like it either.
No, we don't. But it's almost like, and this is the funny thing is, like, patients think we have control sometimes of this, but a lot of the time we don't. If we're employed, we have no control over that.
Yeah. You know, we had an interesting comment here. I don't know if you can see it. It says, the board is not our friend. Same for the physician and any other healthcare professionals. Anyone can literally file a complaint against us, and we are the ones who have to navigate through this. Very little consequence to the patients who filed the complaints.
That's so true. And to that point, it is kind of, you know, you might seem like, oh, it's yes, because we will spend our time and our effort to defend ourselves against that complaint, no matter what it is. And it is estimated that physicians spend, if you have a long career in medicine, you're spending 10 to 15% of your time defending yourself, whether it's with licensing boards, it's with medical malpractice, whatever that may be. And it is unfortunate how that works. There are some states, particularly with malpractice, that I think do it better in terms of protection for physicians. And their systems, like Indiana has a system where 3 of your peer colleagues in your specialty have to review the case before it can go anywhere. And that just prevents frivolous cases. It prevents you having to spend all this time and effort to defend yourself. Like, and it really is, they have a really good model in Indiana. I wish more states would adopt it. And frankly, I feel like one of my passions for the next decade is to try to make malpractice reform a huge priority. And I do believe it should be federally, not state to state. It's not fair because we all practice by our American college of our specialty. And yet we are judged based on which state we live in. And some states are more litigious than others. And it's not really fair, to be honest. We're all following the same science.
Yeah. And with how many doctors are leaving medicine or committing suicide, or, as few barriers as possible to being able to actually enjoy what's an amazing profession. We have a career where we get to help people repeatedly every day.
Yeah.
And yeah.
Yeah, it is sad. And I do think, especially with med mal, it's like the last straw for many physicians. Almost all of my clients that come to me that work with me, they tell me they're ready to quit medicine. They want to quit by the time that they get this lawsuit, with the burnout rates and all of the things going on today in medicine. And, I know that we need more resources for ourselves. We need help. We need support as well. We're people too. And it's like healing the healers, right? I mean, it's essential for us. The shortage of physicians is not going to fix itself quickly. And to keep the physicians in, I mean, I feel like that's one of the things that I do really well with my clients is by the end of our time together, they are figuring out how that love of medicine comes back and they're enjoying it again, whereas it was sucked out of them, before. So I think it is possible to keep physicians in the profession, but we're not doing it very well.
Oh my gosh. Well, I'm so grateful. I something that I've learned since I started my company is there's so many people who are doing things to help with what's going on in medicine, and this is where you come in, and it's so huge. There are so many things that need to be done, and I'm so grateful for what you do for physicians and for, all of us, and, those of us who have kids who maybe want to be doctors when they grow up. I want to be able to tell my kids, yes, you should be a doctor because it's the best. And, I don't know how many people are and how many physicians are encouraging their kids to go into medicine. Whereas before it was like, yeah, you should totally go into medicine. It's the best career ever.
Yeah, I don't think that's happening much anymore. I really don't. I think I tell my kids, don't go into OBGYN if you decide to go into medicine. Um, but I do think the thing is, if you have a heart to serve others and you have a heart for people, it is a really good profession. We're working out the kinks, right? We've gotten to the point of the last straw for things. And this is where I think coaching is enormous in this industry. And anybody that has physicians, if you haven't seen the data, there are definitely over 4 randomized controlled trials about how coaching reduces burnout, exhaustion, and really helps physician well-being. And I'm hoping to collect data on how that affects medical malpractice and how that has helped my clients overcome that emotional turmoil and been able to get them back to that joy. So yeah, I think that there's a lot of evidence that we can really change the culture. It just takes one physician at a time.
That's so good. For the physicians watching, do you have any words of advice for those of us who are physicians, basically?
Um, I would say that there's hope. And the biggest words of advice I would say is if you have an adverse event that you think you might get sued for, or you're getting sued, the biggest thing you could do for yourself is go get help. We have a lot of resistance to this because of credentialing and mental health. You don't want to be that doctor or whatever. And I want you to know that getting help early can change the trajectory of everything for you in terms of the adverse event and malpractice. And you can feel that peace no matter the outcome of the case and still enjoy life. And I think we just don't believe that, right? But I know this. I've seen it. I've worked with. It helped myself. It changed myself. I mean, my case went on for a decade, and when I got help with coaching and memory reconsolidation, which is what I do now, I it just changed and transformed me. And I know it's possible because all of my clients are getting the same transformation results. So I think go get help, find a coach or a therapist, but make sure you say that you want some memory reconsolidation if you're going through something like this, because that's really one of the keys to really help change sort of the pathway that got created because of what is happening to you. So in your brain. So yeah, go get help, reach out. And by the way, I know this is a huge barrier, but people think, well, this could be discoverable then. I'm not allowed to talk about it because that's what my lawyer says, my insurance company. And I want you to know that when you go get a coach or go get memory reconsolidation from a coach, there's no records, there's nothing to discover. There's no records, there's no charting, there's no nothing. And I am developing a safe, confidential, non-discoverable space where physicians can come in to know and learn this stuff.
Thank you so much for that. And if anyone does want to find you, where can they find you?
Yeah, just go to the menmalcoach.com. You can find me on Dr. Laura Fortner or any of the social outlets, and sign up for the wait list for the Healthcare Hero Healing Circle. This is my non-discoverable platform that's confidential that you can go in and learn this stuff that I'm talking about and really thrive and get peace of mind through what you're going through.
Awesome. Yeah, absolutely. Reach out to Dr. Fortner. I mean, you can see she's warm and wonderful and helpful. And, I think a lot of physicians, large number of physicians can certainly use that. So please do reach out. And of course, if you're miserable in a job, you don't need to stay there. So that's where I come in. Let me help you find something better. If you have any questions for Dr. Fortner, please do reach out to her. Feel free to comment here. Don't forget, what did we say? Hashtag malpractice sucks if you're watching this. So thank you for watching, and let's go enjoy our day.
Thanks.